most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
You don't have your sign, do you? Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about, is TENS safe to use for pain? Brad and I have quite a bit of experience with this. We've been using TENS units for 30 years. So at least I have been.
Right.
So I think we're well qualified to talk about it.
You bet.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, join us on our social media channels or our website, bobandbrad.com, the giveaway section, because we are always giving away something. And right now, we're giving away the Dozeology Weighted Blanket. Great for reducing stress in your life.
Right. And there's people out there who are very familiar with it. If they are, they know exactly what we're talking about. This is a nice quality blanket.
This is a good quality blanket. You got to really check it out. So, all right. So transcutaneous electrical neuromuscular or nerve stimulation.
Sure.
That's what TENS stands for. How does it work? So there's two general theories on how TENS works. And Brad is showing one right here. It's one of the TENS units.
This one's already hooked up on my forearm.
Yeah, I don't know if you can see a little pulsating going there on or not.
Yeah, but I'll just turn it up a little bit.
Yeah, then you can make it go. So he's providing electrical stimulation to his arm. And generally how it works is the electrical pulses prevent pain signals from reaching the brain. So if Brad were to hurt his thumb right now, the idea behind the stimulation is to stop that pain sensation from reaching his brain, that big brain of his. So
why, Bob?
The other thing it does, the pulses help stimulate the body to release natural endorphins.
Sure.
So they're that feel-good substances, that are going to make you feel good about things.
It's like after you do a really aggressive workout and you're done and you just feel so good. This does the same thing, but more in a localized area. Although it's not the same, but it's similar.
Right. It's supposed to stimulate overall body-wise.
Right.
So,
but it's still not quite the
same.
Still not the same because you're not fatigued, but you still get that.
You've been going off on a tangent here.
Yeah, I know.
Okay, so what are the reasons? The answer is it safe? The short answer is yes. It's definitely safer than a lot of medications, especially the opioids that people have been on. So, but there are precautions and there's contraindications. By contraindications, when it's a contraindication, I would not do it at all.
Right.
If it's a precaution, you want to take pause and maybe think it through and see if that maybe you do want to try it. But
sure. So
I'm going to list some of the contraindications. Yeah, definitely we've known this one for years. No use if you have a pacemaker. They have the cardioverter defibrillators now.
Right. Any other device that is
basically
on you that's
device in your
powered by electricity, this could throw it off. And
bone growth stimulator, indwelling blood pressure monitor, neurostimulator, all those things. So
you're not going to put the pads on where there's an open wound. Got to have healthy skin.
Are you jumping ahead on me here?
I'm sorry, Bob. I just wanted to say it.
All right, next one. Don't put it over the carotid sinuses. That's right here.
Sure.
That can knock things off as far as your cardiac rhythm. Yeah. So that's right here, right where your carotid arteries would be felt. As Brad had said, damaged skin. Number 4, any reproductive organs. You don't want to put it over that.
Sure. So
I know
if you're
pregnant.
To, yeah. Or for pregnant women, I jumped.
That's one of them too.
Sorry,
yeah, boy, you just can't keep yourself under control.
I got to memorize, Bob.
All right, transcranial. This is an interesting, Brad, because I remember when they first came out with this. So they don't want you putting it on for headaches.
Sure.
Anywhere on the brain there. When they first came out, and I remember one of the scientists came down to Mayo Clinic where I was working at the time, and he was working on that, trying it across the brain.
Right.
So. They apparently.
Were you a volunteer?
I was not. They did not do it to me. So
I figured something had to happen.
You wouldn't put it on your eyes. I think it's obvious, but who knows what people think. Don't put it on your eyes. Don't put it on the oral cavities.
Right.
Don't put it on your tongue or anything. If you have cancer, you definitely don't want to do it right over the cancer area.
Right. If there's something like that, you need to contact a professional.
Right.
Make sure.
Did you say pregnancy? Wasn't that one of those that you said?
Yes, I did, Bob.
Okay, especially on the torso.
Yeah.
Whether or
Right.
not you can do it on the
Right.
extremities, that's a little more questionable.
Yeah.
Epilepsy. They found off that you don't want to put it on the head, shoulder, or neck region if you have epilepsy.
You may trigger.
Yeah, apparently, yes. If you have a blood clot,
Sure.
in which a lot of people get blood clots in their calves,
Right.
and it's
Right.
painful. So I could see someone saying, "Well, I want to put a TENS unit on there," but you don't want to do that. You don't want to loosen up the blood clot, send it up to the lung, and
Right. Cause a
yeah.
real more of a problem you already have. Yeah.
If you're bleeding, if you've had recently radiated tissue, so let's say you're undergoing cancer treatment,
Sure.
and
Mhm.
that tissue is a little thin,
Compromised.
maybe compromised.
Mhm.
You don't want to put a stimulation unit
Yeah.
over. And if you have any infections, osteomyelitis, tuberculosis, anything like that, you wouldn't want
Right.
to do it either.
Sure.
So,
I got a really good example of something that you may be concerned about if you got a Can you zoom in on that? I've got the intensity cranked up enough where my muscles are. I've got them in the place where my muscles contracting and it's oscillating like this, and I'm not doing it at all, and I'm not concerned. I mean, it feels kind of good actually. I like TENS unit on myself, like a lot of people do, but that's fine.
by the way, if you're interested in a TENS unit, the one we really like is I Relieve. We'll have a link down below. If you go to it, has a landing page for us even,
Sure.
and they got great discounts on
Right.
there. That
Yeah.
for each one, they take off quite a generous amount. So it's a relatively inexpensive device on some of the lower end ones,
Right.
and it's pretty easy to use, and you can hide it in your pocket. Again, definitely better than any opioids.
Oh, right.
So-
Yep. Yep.
All right, I'm just going to go over some of the precautions real quick here, Brad. So again, these are ones that you want to take caution on. I wouldn't say it's absolutely no, but cancer, if you're going to use it on a distal site. So let's say the cancer is here, but you want to use it on your ankle.
Sure.
Just be precautious.
Yep.
Pregnancy, the same thing. If you're going to do it over the knees, hand, or ankle, there are some acupuncture points that they said can actually increase uterine contraction.
Oh.
So, and that was a moderate amount of evidence that found that out to
Okay,
be true. So,
sure.
I didn't know that. Did you know that?
No, I did not, Bob.
If you have cognitive impairment, you may want to be. Did you see me do that?
Yeah, they saw Bob. Why, Bob? Why? Let's carry on.
I mean,
with the
obviously, because the
program.
person might not understand what's going on. And
Oh, right.
so.
You really do. Yeah.
Cardiovascular disease, don't apply it to the chest.
Mhm.
You can use it at sites other than the chest wall, but not the chest wall.
Sure.
Some impairments that might make it difficult to do if you have extreme edema,
Mhm.
swelling, if you have extreme adipose, which if you're really heavy, it may not work as well.
Right.
If you've had adverse experiences to TENS before, like it freaks you out, I probably wouldn't try it again, would you?
Yeah, I've had three patients that I just turn it up a little bit, and I think it's a psychological thing.
Yeah, there's some
feel
people that
that-
don't like electrical
right,
stimulation.
and then there's some people that I just think it feels good. It's just as long as you don't go really high with it.
I had a
obviously.
girl in my class, I probably shouldn't even tell this story, but she was like wacky about it. Like she loved it.
Oh,
Like really loved it. Like
say no more.
Say no more.
Just carry on, Bob.
right.
Why?
all right, and I want to again put it across the chest. And if you have impaired sensation from scar tissue, I'd be careful there too, because it just
Right.
probably you won't get good feedback, and you won't know if you're doing it too high or whatever. So.
Right. At that point, you'd have to depend on the muscle contraction for feedback.
So with those precautions and contraindications, again, generally a very good unit to use for pain control. It's not going to cure your pain, but
Right.
sometimes it helps you get through those times when you're dealing with pain that just doesn't go away.
Right.
So
Right. And
intractable
again,
pain.
avoiding the medications.
Right. So,
Mhm.
all right. Remember, Brad and I can fix just about anything.
Except for
A broken heart.
there you go. I don't know if this is going to help that.
You can't put it on the heart.
Right.
So you
okay.
can't.
We're going to have to toss that idea.
All right. Thanks.
Another chapter.